Welcome, everyone, to Bucket Courses. My name is Sarah Smith. I have the honor of partnering with the Bucket Course Committee to bring you these Bucket Courses every week. I work in the Office of Community Partnerships Planning and Research at Grinnell College. A couple of reminders before we get started. If you could please silence your phone and turn your T-coil on. We'll have time for questions after we take the break, so you can hold your questions till the end. And then one last thing, do we need to save any chairs for anything afterwards this week, everyone? Okay. So we can put all the chairs away together would be wonderful if you can and have the time following. So today, very excited to welcome Brooke Holder from UnityPoint Health, Public Health. I really wanted to, for many reasons, Brooke is going to be here again with another group coming up soon, but I wanted a time for Brooke to just talk about public health. I personally have a special place in my heart for public health. My dad's sister was a public health nurse for her entire career up in Butler County in Parkersburg. And growing up around her, just knowing just the value in access to vaccines, to information sessions, to help, quite honestly, where, yes, obviously our hospitals provide that as well, but public health is just an amazing branch of that to help with our overall wellness. So I thought it'd be great to kind of hit a reset and learn again about public health from you and what, in particular, the public health here in Grinnell, because it's gone through a little bit of change. So, explaining that and understanding that. So, without further ado, will you help me welcome Brooke Holder from UnityPoint Health?
Thank you so much. That was so kind. Yes, like she said, my name is Brooke Holder. I have been with public health for just under 3 years. August will hit us 3 years. I started as a nurse about 13 years ago, working in various roles within the hospital here. I also worked home health and hospice for Grinnell as well. So I took a little bit of break after COVID to stay home with my kids. And I don't know if you guys know Deb Fraker, but most people do. So Deb Fraker called me up. She goes, "You need to come here." And I'm like, "Okay, Deb, I'll come." So I got there and I was like, I don't know if public health is for me. It's very autonomous in the role. You have to make your work, right? So I was like, I don't know anything about this. And then I learned that I could talk to people and I was like, oh, there we go. I can just talk all the time. There, I found my job, right? My grade school teachers would be put to shame now because that's what all my report cards said was to talk too much. I don't know, whatever. Anyways, so I started as a public health nurse, started up the Unlocking Brain Fitness program, the keys to dementia prevention. Some of you guys have taken that course, and I'll talk a little bit about here later. Took on the role of the tobacco educator and resource for our county. I got to know a lot of people, network, and grow some partnerships. And then my boss took another role, and so I decided to step up into her role. So I have been the public health manager for Powesheik County for about 1.5 years. Love it. I did not know how many doors were going to open, how much education I was going to be exposed to, things that I never thought that I would love doing, I'm doing now. So it's really neat. And I continued working in the Brooklyn nursing home because I was working there just PRN, and I continued up until this last month where I decided to retire that job out. But anyway, so I continued to have that hands-on nursing role, but up to this point not. So how does that all pertain to what I'm doing now, right? Everything that we go through in life, we use those experiences to benefit where we are in this time. So public health, what does that look like? Anybody have a raise of hands? What is public health to you? And just blurt it out. Vaccinations. Yeah, just the COVID shot, right? That classes. Yep. So there's a lot. Those are right answers. Yes. There's so much to it though. So where are we located? We are at Dr. Light's old building still, the Light Center. Home Health and Hospice moved out by Walmart underneath the Prairie Fire Gymnastics, but we stayed. So we are still there. We are unique in the fact that we are a hospital-based public health. There's 99 counties in Iowa. And there's a handful, it's about half and half. Half are about our hospital based public health, and then there are county-based public health. There are benefits and cons, pros and cons to both, right? I really like having the hospital. It bridges a huge gap, and we'll learn about that here in a little bit. Okay. Okay, so what is public health? Sorry, I have to read some of this too, so it sounds really good. If I can find my mouse. Okay, so public health offers services to promote and protect the health of the community by creating conditions for all community members to have a healthy lifestyle through engagement, reducing health disparities, and attending to the needs of the most vulnerable populations. Public health strives to improve the quality of life for all Iowans by assuring access to evidence-based population health programs, services, and activities in the following areas. Oopsie, sorry. I don't know where my mouse is. Oh, there it is. I'm not very tech savvy. That's why I didn't go into IT. Okay, so in the following areas: promoting healthy living, preventing injury and violence, protecting against environmental hazards, prevent epidemics and the spread of disease, improve and support public health performance, and prepare for, respond to, and recover from emergencies. So how do we know what to do? We, in public health, base our initiatives on the 10 essential services of public health, and that's nationwide. That's worldwide. The 10 essential services of public health. So Poweshiek County might do things a little bit different than Jasper County or than Dallas County or than Polk County, right? So we focus on those 10 essential services that are listed up here. I'm not going to read them all, but I can send them out to you. But it's assurance, it's assessment, it's policy development, it's equity. How do we provide the best care to the people of the community that we're living in? We aren't the same as Polk County or Dallas County, right? Completely different living environments, right? We don't have public transportation. We don't have as much diversity here. We have different populations. We're rural and they're urban, right? So some of the things that we do that are on this wheel is to assess and monitor population health status, investigate, diagnose, and address health problems and hazards to the population, communicate effectively to inform and educate people about health factors that influence it, and then how do we improve it, to strengthen, support, and mobilize communities and partnerships to improve health, to create, champion, and implement policies, plans, and laws that impact health, to utilize legal and regulatory actions designed to improve and protect public health, the public's health, assure an effective system that enables equitable access to the individual services and the care needed to be healthy, and to build and support a diverse and skilled public health workforce, to improve and innovate public health functions through ongoing evaluation research, continuous quality improvements, and then lastly, to build and maintain a strong organizational infrastructure for public health. So here in Poweshiek County, we provide services to enhance healthy lifestyle living. So we go out in the community and we ask what kind of stuff do you want to learn? What do you want to do? We go to the farmers markets. We go down to Montezuma to their summer nights on the square. We go to Brooklyn's Flag Festival and the school events that the schools put on. They're just now starting to ramp that stuff back up post-COVID. The first year that I was with public health, I was really pushing. I learned to be respectfully annoying, trying to get people to let's go. This stuff's important. COVID is on the downhill now. Let's get back in those schools and let's educate. Let's get these kiddos going. I have really great friends that are teachers that are seeing the side effects of our children from COVID, right? That the preschoolers, their social skills aren't developed. Their speech isn't developed, right? The first graders, even up and through middle school, a lot that social isolation. You think about how it made you feel, right? I know it made me feel sad, and I was still working full time, isolated and sad and not connected. Think about those children that their brains are still developing, and they needed that socialization to develop, right? So we look and see, and we base all of our initiatives off of what the community says with the community health needs assessment, and we'll talk about that in a little bit too. But we plan and we meet together with the community stakeholders and work on different initiatives, different plans, different ways to go around things. How can we meet the community and provide really engaging programs and initiatives to get our community healthy? We help to prevent disease outbreak. So what does that look like for community health or public health? We meet with the state on a quarterly basis, on a monthly basis, and then anytime there is, say, somebody goes to the doctor and here in Grinnell and they have, oh my goodness, salmonella. Okay, they're diagnosed with salmonella or another communicable disease. The state gets that information, and the state sends it to us in a database and per email, and then we contact that person, and we ask them all the questions. So if I call you and I say, hey, I've got some questions. Were you at the doctor and you were diagnosed with salmonella? Don't get mad at me. I'm just doing my job. So we're going to ask you a ton of questions. But it's not to dig into your personal life, but it's to help prevent a disease outbreak. We have Campylobacter, we have salmonella, we have, oh my goodness, there's a whole bunch of COVID, right? If you're diagnosed with these, we're going to call you, ask you these questions, and then do trace follow-ups, right? So you ate at McDonald's. I'm not saying McDonald's has it. I'm just using it as an example because this first one came to my mind. You have salmonella. Well, I ate at McDonald's 2 weeks ago, and, I'm having these symptoms. I went to the hospital. No, they didn't give me medication. Yes, I followed up with my doctor. I have 6 people that live in my home, and 3 of them have the same symptoms. Okay, well, did they go to, so we do trace mapping, right? So we can prevent a disease outbreak. So that is something that we do. We have 4 nurses. I guess I didn't even introduce my staff. Oh my goodness. There's 6 of us at Public Health. So there's myself, which I'm an RN. I have 3 nurses, Deb Fraker, Stephanie Crawford, and then Sadie Hagel. Those are all RNs. I have Christy Reedy. She's an amazing administrative assistant. And then I have our wonderful home care aide, Danette Johnson. So we'll get to what she does too here in just a little bit. So we work all together to provide these resources. My nurses work 4 days a week with 1 day off because they're so super lucky. Danette works 4 days, I work 5, and Christy works 5 days. So depending on who's on, usually Deb Fraker mans the communicable disease outbreaks, and she'll be usually the one that calls. But if she's not there, Steph or I will give you a call. So we all have a foot in a pot. But then we all help each other out. Okay, what else? Prepare for and respond to disasters. So did you ever think that public health would respond to a disaster if there was, say, the derecho? Yeah. So we have our county emergency manager, Brian Paul. He is wonderful. We work really close together along with our first responders, so our police and our ambulance crews and our fire departments. We all work together. We do lots of different trainings at the regional level, at the state level, and we have coalitions broken up into whichever region that we are in. And we work through all types of different scenarios. So I just did, I I just did a training at the state with our coalition on pod dispensing. So pods would be like, you remember H1N1 when everybody went out to the GARC and stood in line for hours and hours and got a immunization. So that's what a pod would be like. So say with COVID, right? So you had to come get your vaccine. You would look and see where they're doing a drive-through clinic, or I can go in this building at this certain time. So we do that for tons of different things. So if there's a chemical spill or somebody has exposure to a toxic chemical or radiation, we do like the hazmat section of it. We also do the pod dispensing if there was, like, knock on wood, like an anthrax, and we had to get tons of medicine out to a ton of people. So that public health sets those pods up. We also work with Brian Paul to do like the mass communication, right? So with the deratio, we did mass communication with Brian because he's hands on the ground, seeing what everybody needs. Public health is doing other aspects of it. Reunification centers. So if people need to, like with the tornadoes down south, right? If heaven forbid, a big tornado and we were all separated and we needed to get to people that we loved, our families and friends, make sure we could call this the reunification center. So public health sets up those aspects. There's tons of scenarios I could go through, but you kind of get the idea a little bit? Okay. Okay, so promote and educate on healthy habits. This is one of my favorite things. Even though I do love a good Diet Coke, it is not very good for you, right? So I like to, my kids get so annoyed of me, but we look at the food that we eat and consume, and I'm not a scientist, and I'm not backed by this information, so take it and look it up on google.com later when you get home. But the things that we eat, right, they're packed full of sugar, they're packed full of dyes, they're packed full of chemicals and all the nasty things, right? That you ingest that. What do you think that's doing to the insides of our bodies, right? Not very good things. So I try to do healthy, oh boy, installer. Hopefully this doesn't shut down because then we're in big trouble. I try to really focus on especially educating our youth. So Grinnell has a wonderful program, the Mileage Club for the 3rd and 4th graders, and they have the Power Kids. BGM and Montezuma don't really have that. So when I took this role, I looked at public health and I was like, you know what? Grinnell has so many robust, amazing programs that our entire county could benefit from, right? So many people come to Grinnell. I come to Grinnell to get my groceries. I come to Grinnell to go to Dairy Barn. I come to Grinnell to go to the park and the splash pad and the pool and, right? So does everybody else in our county. So how can I expand the resources that could be countywide throughout the county? And if there is a gap, how can I help bridge that gap? So a lot of that does stem with the healthy habits and education and promotion with those. So I'm trying to bridge that out. So BGM will be starting this next week, the Mileage Club for their 3rd and 4th graders. And there's an amazing program at the state, 5210, teaching them, 5 fruits and vegetables, don't watch so much TV, get up, move, water, that kind of stuff. So educating our youth so that they grow up and have those healthy habits. It's hard to teach an old dog new tricks. So teaching my mom that she needs to, lay off the donuts and eat more spinach. Just kidding, Mom. If she watches this YouTube, she does. She's really great. But you know what I mean? It's hard to build those habits after my husband's a meat and potato eater. I put zucchini in his food last night. He picked around it like a child and then threw it away. I'm like, you know how expensive that zucchini was? Like, seriously though, fruits and vegetables are expensive. But not only teaching and promoting healthy habits, but teaching how to grow your own. So starting those little seedlings and starting stuff like that, I think that is so huge, especially with the cost of food now, for us to learn to take matters into our own hands. So I do a lot with that. My team does a lot with that. Healthy habits are huge for the whole team. We practice what we preach, although we do support Grin City Bakery and Dairy Barn. Habit, balance, right? Balance. Okay, so anyway, assist access to care services. Like I said, we're hospital based. I use Grinnell Hospital. Many people don't use the facilities that they work at, but we have amazing providers. Grinnell, we've really put so much into this hospital to make this hospital a very valuable resource to our community, our med-surg department, our OB, our emergency room. We have a wonderful market president and a wonderful vice president that truly care and value the people in our communities. Doing lots of outreach and getting out there and knowing who our community is. I mean, that speaks volumes, I think. So, and trying to see truly where the gaps are in our community, bringing providers from Des Moines so that we have really great providers here, making sure that, we have a wonderful OB department because Marshalltown and Newton aren't delivering babies anymore. That's a huge need, right? So making sure that we have the room there, making sure that we have providers when our providers need a break. So we bring providers in from Des Moines and Iowa City now to make sure there's coverage so that there's always care here. I think being on the inside and being on the outside as a parent and having my own struggles personally, seeing what has been done at the hospital in the last 5 years, 10 years, it blows my mind. I'm so proud to be a UnityPoint employee, and I'm not just saying that because I have the badge on. Collaborating with community partners. So when I first took this role with public health, I learned that a part of grant requirement with the tobacco grant is I had to be a part of a coalition, which was the Healthy Choices Coalition. Raise a hand. Does anybody know what the Healthy Choices Coalition is? One person. Okay. Well, guess what? You're all going to know what the Healthy Choices Coalition right now. So the Healthy Choices Coalition is a collaborative group that was nothing. Pretty much it was like 1 through 7, answer your questions, and then we all leave. I was so bored at that meeting. I was like, we have got to spice something up here. This is not fun. I mean, that's an hour out of everybody's day when we're all really busy. It's a collaborative meeting with community stakeholders, hospitals, schools, school counselors, the Arns Foundation, the college, my public health, what? Arns Foundation. Yes. Yep. So we all met once a month on the 4th Monday of every month from 12 to 1. We meet, and we weren't getting anything out of it. And then I learned about our neighbor Jasper County Cares Coalition, and I was like, you have how many? They had like 100 people. We had like 5 people show up to our meetings, and I'm like, oh no, this has got to change. So I'm really pouring into this collaborating with our community partners. If something happens, if I have to prepare and respond to a disaster, who am I going to call? I have no idea, right? Then I am trying to build this coalition that if somebody in the community needs something, that's the first place that they go. It's a resource sharing. Everybody in this room can come to that meeting. It's open to the public. I've been inviting all the businesses that I can get. We now have like a good 20 people there every single time, which doesn't seem like a big step, but in the last 6 months, that's a big step. Trying to prove that the meeting is beneficial. So it's resource sharing, talking about events in the community, talking about open jobs, talking about the empowerment center and preventing homelessness and what are the needs, right? So making a robust collaborative meeting for people to build off, and then sharing all those resources after the meeting as well. So we're trying to work on initiatives to be active in the community as well. So more to come with that. So listening and learning what really matters to the people in this community is what our purpose is how we serve, is how we know what we're doing. So the community health needs assessment, I mentioned that earlier. So this is a assessment that comes around every few years. So public health is required to perform theirs every 5 years, and the hospital is required by federal law to do it every 3 years. Since we are a hospital based, and most public health do work with their hospitals, because we're all working towards the same thing, right? Why work in two separate silos? So anyway, we are in the midst, at the very beginning stages of our community health needs assessment. The hospital is amazing that we work with an organization called PRC that does our assessment for us. They do the hard, busy work for us, and then we get to take all the credit for it. No, just kidding. But after the assessment is completed, we will sit down and look at the results of that assessment. The assessment, and using the Healthy Choices Coalition will be really great to help capture as many results as we can, because I think the bare minimum is like 200 or 300 participants in the community and like 200 stakeholders. I want to get as many people as we can. This cycle we're breaking it up into zip code, which is going to be super great for us to see who needs resources and what gaps can we fill. So after the assessment is completed, we'll get the results, and then we'll come up with a plan that we'll use to guide our initiatives and providers and all the things. So right now we're sitting down to write up a form, a assessment, I guess, of what we have done over the last 3 years, and then see how we can continue to build. And the awesome thing with using PRC is after this assessment, we'll get to compare it to the last assessment and the results. So we'll get to see what people are saying over the next few years as we continue to use them. So. Did it go? Okay. So why is public health important? Public health touches each and every single one of us, every single person in our county. Doesn't matter if you make $1 billion a year, if you make $5 a year, right? Everybody in between, 0 to 100 and what's the oldest one? 103, right? I think, yeah, everybody. So things like clean water, vaccinations for children and adults, motor vehicle safety, Smoke-Free Care Act, all of the things that that make living in the community. So I kind of mentioned that we are hospital based. You guys understand that. So how public health works, because like I said, there's hospital based and then there's county based. Every single public health has an appointed board of health. So the board of health, we all report to the board of supervisors. So it's like a tier. So it's the board of supervisors, then the board of health, and then the Board of Health funds public health. Poweshiek County's Board of Health subcontracts with the hospital to employ us. So we still meet with the Board of Health every other month. So that's kind of like the guidelines. 6 times a year you meet with your Board of Health and report to your Board of Health. We have an amazing Board of Health. They're very supportive of our public health and grateful for the community initiatives that we do and the work that we do for our county. They are quick to provide feedback, and I'm not one that doesn't. I love that that feedback, because how do you do better if you don't know what you're doing wrong, right? You don't know what you don't know. So they're really great to provide that. So that's why public health is important. So I'm going to kind of go into what is specific to Poweshiek County and Grinnell's public health. So we do disease prevention here, and preface this with every public health is a little bit different. I said that earlier. So what we do in Poweshiek County might not be what Jasper County does, like I said that. So that's why it's important to kind of go through what we have. So disease prevention, we provide immunizations from 0 to 64 years old. We do offer flu and COVID over 64 years of age, so the 65 plus, but we unfortunately do not bill Medicare Part D vaccines like your shingles, your Pneumovax, and that. But we have really great partners, and we're not ashamed to say that. So Hy-Vee, to get your Fuel Savers points, they're wonderful. And the other pharmacies, I don't know, Medicap does that or not, but we're unique in the fact that we offer the VFC program. So it would be our kiddos that are on Title 19 or Medicaid or don't have insurance. So the VFC program, the Vaccines for Children's program, is a government program that provides those vaccines for kiddos. So we're able to give those, and then private, so like your Walmart, your United Way. So we do both programs for vaccines. My nurse Steph, she oversees the audit portion of this program. So we go into the schools and make sure that all kids are by law up to date, or they have the right documentation in place. That way there isn't anybody missing, that if they need to have their vaccines, they get it. That way we're protecting everybody, or have the documentation in place to say that, you know, that they're not going to have it. We also do daycares to make sure that the daycare children are up to date or have proper documentation in place. And then Steph also goes to Head Start here in Grinnell, and she does screenings on them, health screenings, to check their height, weight, and vision, and refers them on if they need any care from there. Communicable diseases, we kind of covered that already. We also do TB testing for anybody that needs to have. We get a lot of students, like nursing school students, and that they want to be a CNA at a nursing home. They have to have a TB screen done. And then we follow up with latent TB, so it's not active TB, but you have to take medication so that you don't go into active TB. So we do a lot of monitoring of that when they find out that they do have that. We do public health flu clinics, which I'm sure a lot of you guys have seen us out and about. We do 3 community clinics, BGM, Montezuma, and Grinnell, that are open to everybody. We used to do a drive-through, but that after COVID kind of just trickled down, and it wasn't worth the nursing time to be out there, which stinks because that was kind of fun to do. And then we go to a lot of the nursing homes and do flu clinics there. And then the businesses, a lot of businesses in the area call us, and we go out there, and they trickle through, and we get them for their flu shots and COVID vaccines. We do a lot of collaboration with the schools and community partners for disaster preparedness, like I said. We do a lot of trainings for the community and businesses. So we do go into businesses. Bayer and Brownells had us come out a couple different times. We did tobacco education and mental health. We did some education on mental health, and what else do we do? Any topics that they want to talk about. Specialty clinics. We do foot care clinic. We have Deb do that because I don't like feet. So Deb likes feet though. So if you need your toenails trimmed, you can come to our facility and sit in the really nice comfy chair that raises your legs up, and she'll trim your toenails. The clinics are held twice a month by appointment on the 2nd and 4th Thursdays of the month in the mornings. Though I will put a plug here, if you have diabetes, well, we'll send you to your foot doctor, because if you have diabetes, you should be seeing a podiatrist. We do blood pressure clinics. Those are held every Thursday. You don't have to have an appointment for those. From like 1 to 2, if you just want to have your blood pressure checked. Sometimes it's just good to know. Come in every Thursday, come in 1 Thursday a month, whatever you would like. And Sadie oversees that program. Excuse me. We do corporate wellness. So we work with Brownells and oh my goodness, Grinnell Mutual. We do blood, and the county and the Grinnell school. We do blood draws for them for their insurance packages. So we do that quite a bit. We have one actually at Grinnell. My goodness, I say college. Grinnell Mutual every week this month. So that is fun if you like to poke people. We have a community care clinic. Did I just go one there? Yep. Our community care clinic is a Our community care clinic is a program that I'm actually really proud to have in our county, and I am working to see how we can grow this access for our community. It serves the under or non-insured population. So if you don't have insurance or your insurance doesn't cover, there's specifications on like you can only have 2 doctor visits a month or a year or something like that. That's who would benefit from this program. It's the first and third Thursdays of each month from 2 to 4. So you can see why that would be a problem. From 2 to 4. If you don't have insurance, you can't afford insurance, you're not going to take off work to go to the doctor. So to access this clinic, you can call public health to get an appointment. I'm trying to grow it because I think it needs to be more often. I think it needs to be after hours. I think it needs to be at least once or twice on the weekends. It's a volunteer-based program, so that's why it is so hard to get providers to volunteer their time to work there. But y'all met David Paul recently, so I'm working with him to hopefully fill this gap so that we can provide the service. One question that's asked often is, okay, we have this free program. They give a medicine, they can't afford the medicine. Well, we work with SafeNet RX, and it doesn't have all the medications that a patient would need, but a lot of medications can be free through this program. So putting another plug in there, if you have antibiotics or medications that you had prescribed to you and you never opened or didn't use, say Coumadin or warfarin, right? Your doctor ended up changing you and didn't use the dose. You can donate it to the SafeNet RX, and somebody in need can utilize that medication. If you get the bubble packs or pre-filled medications, I think those are more preferred than a bottle of medication, but you are able to donate your medications to them. So mom and baby health.
Actually, Brooke, this might be a good, if you don't mind, time to stop.
That'd be great.
We're at like 10, we're almost at 10:40. We'll take a little bit of a break and then get back here in about 10:50, about 10 minutes. Does that sound good?
I'm going to have to start talking faster.
Okay. If that's okay with everyone, let's go ahead
Absolutely.
before we go on to, the next slide. So let's go ahead and stop, take a little bit of a break, and then we'll resume about 10 minutes. Thank you.
Okay.
We can have everyone find a seat, and we'll get back to our presentation in a little bit. Okay, great. And I did see people come up and grab stuff. Obviously, when this is done, please come on up and take a look at the flyers and brochures that Brooke has. But let's resume mom and baby health. We'll let you get going. Thank you for talking with people during the break, too.
Yeah, of course.
But yeah, great information. And then, like I said earlier, we'll take questions in a little bit when this is when you're done with your presentation. So, all right,
Okay,
back to
thanks.
you.
Thank you. Okay. So mom and baby, what do we do for mom and babies? We have a postpartum home visit program. Diane Dalmadge used to run this program, and she did an amazing job with it. We were able to expand our services to Jasper and Marshall County as well. And then we also go down into Mahaska. Sorry, this thing is getting cut in my hair. Down to Mahaska, over to Iowa Valley. As moms deliver at our hospital, Steph will go introduce herself if they agree to let her come in the room. And then Steph kind of just educates them on what she can provide in the home. She doesn't try to overbear them because having a baby, you're in a different element at that point. So she calls them after they go home about a week or so and schedules a home visit. This is for all moms. So she goes through, if someone's breastfeeding, they go through lactation support. If they're bottle feeding, she goes through education with bottle feeding. Postpartum depression and noticing if it's postpartum depression or baby blues. She does a screen on them. She weighs the baby. We always have some gifts and different resources for the mom in a bag, and she goes through that stuff and leaves it for them. And they can have a visit up to 1 year of age. So if babies are breastfeeding up through that 1 year and they have a problem at 7 months, Steph can always come back if their supply starts to drop, or they just need her there for emotional support. Sometimes that's all they need. So Steph does have a growing program with that. On top of the the funding that we received through the Center of Excellence grant, we also applied for a DCAT or decaterization grant. The background on this is it was a child and welfare. It's child and welfare funding. It used to be used at the state level in certain pots, and they decided to put it back into the local level for family centered. So we applied for this grant and received funding to increase access to early literacy. So when Steph goes into the homes, Poweshiek County is so blessed with Read to Lead to have the Dolly Parton Imagination Library funding. So Steph goes in the home and she helps make sure that they're signed up for that. So our funding through this grant was to supplement the Read to Lead. So we paid for that first year of life worth of books. So they get a book a month up to 1 year. So we'll do some data collection with that, with the moms and stuff for that. But then, so like I said, we offer lactation services and support at Public Health. We did take one of our supply closets and turn it into a lactation room. So if moms are there with babies to get their immunizations or for any other reason, they can use that room to feed their baby. Or if moms don't want Steph coming into the home for a postpartum visit, they can come into our office and do that same postpartum visit with the weight and everything. We used to have the babies room, or the babies room, I think it was. We revamped it into the village closet. So there was things attached to the baby's room where you had to take classes and earn points, and it was a great program. But when my oh my goodness, I cannot think, sorry. Took a break and now I'm off my roll here. After COVID, it kind of consolidated, and so we revamped it in the last year to be the village closet, and it is free resources for anybody that needs it. So there's no classes or anything attached to it, and anybody in anywhere, Jasper County, Iowa, Marshall, if they need something, they can use it. It's not just to Poweshiek, but we mainly get the moms that deliver at our hospital. So we have clothing up 0 to 12 months, all kinds of supplies for babies, and then some maternity clothes as well. We're still trying to get the supplies to ramp it up. Mainly people are bringing donated items like onesies and stuff. We're needing sleepers, and a lot of people are asking for bathtubs and stuff. So we're working on getting like an Amazon wish list through our marketing department right now. They're helping us create that so that people can go on, scan a QR code, or just go on Amazon and see the main items that we're using. So we're kind of keeping track of who's using it, what they're asking for, and so forth. So we did have funding from the babies room that we kept off to the side and didn't touch, right? So we did use some of that funding to purchase diapers and wipes because a lot of people have been asking for diapers and wipes. We are monitoring, who's taken what, when was the last time they asked, and just to make sure it's all fair. But everybody that asks for supplies gets diapers and wipes as well. Our CPPC, which is a child abuse prevention organization. So I've been with this group since I started. I kind of took over that. It's through the state. We do different initiatives to raise awareness and educate on grooming for children and child abuse and how to talk to your kids and all that good stuff. We did bill the funds for the grid shock. I don't know if any of you guys have seen it. It was a sex trafficking or human trafficking presentation that we had in this room in Grinnell, and then we had it in Brooklyn, and then I think Montezuma just had one. But I can share resources and information about that too here after the class. But this next round of fundings, we are going to use to purchase ATV helmets for youth, and then work with our local response agent. Oh my goodness. local response teams, so the fire department and the EMS, to do some education. And then we're bringing in the University of Iowa's ATV task force. They have like an ATV simulator, just to raise more awareness, encourage the helmets of kiddos riding on ATVs. I live in Brooklyn, and I see kids fly by on things all the time that shouldn't even be in town. I mean, it's all over, and kids aren't wearing their helmets. It's not cool to wear your helmet on a bicycle, let alone an ATV, right? So raising that awareness. Car seat certification. So the OB department is car seat certified. There's a couple of nurses up there that are, but we also are working on getting our staff car seat certified. I have one nurse that's car seat certified right now, myself, and then Steph will be certified within the next 6 months, to make sure that car seats are installed correctly and effectively. And then we also have car seats in our office that was purchased with the CPPC funding from years ago, to distribute to families that need a car seat, or it's outdated or whatnot. So if you know somebody that doesn't have a car seat or needs a car seat, we have all 3 stages of the car seat, so booster seats and whatnot. And okay. So brain health, I kind of touched on that at the very beginning. We started a program called Unlocking Brain Fitness, Keys to Dementia Prevention. It's a 10-week course. It covers weekly over the 10 essential keys, if you will, to decrease your risk of developing dementia by up to 70%. It's an evidence science-backed program, and it has continuous ongoing research. They are changing the name, and I am so sorry I did not catch the name of what they were. I handed this program off to my nurse, Sadie, and she just told me the other day that they are changing the name of it. So there was an epidemiologist, Dr. Quinlisk. She came out of retirement to pour her heart, soul, blood, and sweat into this program to create, to help educate and help people decrease their risk of developing Alzheimer's and dementia. She is wonderful, and she's working with doctors up in Des Moines. Like I said, it's continuous ongoing research that they're actually doing. So with the Unlocking Brain Fitness, to participate in the course, they don't want you to have any cognitive decline at that point, but now they have kind of revamped and added another program where if you have cognitive decline, because they're seeing research changes since they began this course, so they're making it a 14-week, not this one, but another course, a 14-week course with mild cognitive decline. So it's really cool to see how it wasn't just created and then put in a book and, okay, now we'll do something else. So they're continually researching and developing it. Along with that, we started an Alzheimer's support group at Public Health. We meet on the second Monday of every month from 10 to 11. We are looking to maybe move it to St. Francis and the Mayflower to have the meeting like right before lunch when families will be coming, meet people where they're at. It's a small but mighty group, and the group would love to have people join because they're in the trenches right now, and they need some assistance and that support and help and guidance. So trying to grow this program. So if you know somebody that has a relative, or if you're going through it yourself with dementia, Alzheimer's, or you have had a family member go through it and you're a little bit aware and you want to provide some support, we'd love to have you attend it. Well, I already went over the Healthy Choices Coalition. So we're just going to skip that one. Does anybody have any questions about the Healthy Choices Coalition? Okay. Emergency preparedness. So I briefly went over a little bit what we're doing, but I want to tell you some of the initiatives that I learned and I stole rightfully from other public health that had done this in our county. So, like I said, we meet quarterly with our region. We have monthly meetings, but we meet as a group quarterly, and then we kind of go around, we do a red robin, kind of go around the table and say the cool things that we're doing. So, I write down those ideas and I bring it back. I'm like, okay, we have gaps we can fill, right? So AEDs in the community. So you're going to be seeing, now that it's getting nice outside, you're out and about, you're going to see these big yellow boxes, or maybe you've seen it in the newspaper or on social media. There's 2 boxes at Orange. There's 1 box going to be going at Central Park, and then 1 down at the County Conservation at Diamond Lake. They're outdoor, climate-controlled AED devices that are accessible by dialing 911 in the event that you're having somebody's having a cardiac event and you need to provide AED, right? So you dial 911, they'll give you the code to access it. You open it up, take the AED out. There's adult and pediatric pads in there for us to use 24/7, 365 days in a year. So they're always accessible, which is great. So I purchased this with our public health emergency preparedness grant funding for our county. So in the next few years, I'd like to try to put one in Brooklyn and try to put one in Malcolm and, areas that have events, but I tried to use the locations that we have activities year round at. People are using these grounds year round at. We are working in conjunction with announcing that. We're working in the community to educate on hands-only CPR. So we have some little ambulances that give you just the right amount of depth to teach. So we've gone to the county fair, all those little outreach things, the farmers market, the summer square, the Brooklyn Flag Festival. Anytime we can get out and go do that, we'll bring that out. And then Stop the Bleed. So they're military grade tourniquets and little kits that we teach people on, like silicone limbs, how to stuff the gauze, stop the bleed, and then provide some education and give them some cool looking tattoos. So doing that, and then I'm working with our EMA, Brian Paul, and then Patrick over at the fire department, and then Tracy, and then I cannot remember the lady down in Montezuma's name, but we're working all together to provide some free events for the community to come in, learn how to become CPR certified, to learn how to stop the bleed if you have to do that. And then how do you do it if you don't have the kit? I did not realize that a normal belt would not be enough pressure to actually stop a bleed. So how do you do that if you don't have that kit, right? So Stop the Bleeds at the schools. So Grinnell was really ahead of the game going into this. They worked with funds, I think through the college, actually, to put Stop the Bleed kits in some of the schools, or all the schools. And then I worked to add more, so every floor of each school, and then if there was the high school is pretty far distance, make sure that they had enough Stop the Bleed kits to cover their grounds. And then Brooklyn and Montezuma have enough kits to cover their grounds on each floor, as well as the county courthouse has Stop the Bleed kits as well. And then we just got in last week individual kits. So these Stop the Bleed kits have multiple kits inside of them. And then I did get individual kits for every yellow school bus in the county as well. So that was exciting. And then we got to teach all the staff and bus drivers how to do that. So they're prepared. I will work on other initiatives with Stop the Bleed kits, like our county vehicles that, scrape the roads, or like our county city workers and stuff like that, make sure that they're covered and with more grant funding in the years to come. The naloxone boxes and vending machines, I'm sure you guys have seen throughout the county or right outside. So our county received opioid settlement funding through the state, and I was asked to come up with some ideas. Well, I got this idea through another public health in the state of Iowa. We utilized Steps of Hope Ministry for our boxes. We purchased 3 boxes, so they're repurposed newspaper stands. We have one at the Brooklyn Library, one outside the county courthouse, and then one at Iowa Valley Extension College down here. They are filled with Narcan, and then also sharps containers and education and resources for assistance, for help. Narcan's used to reduce, oh my goodness, what is the word I'm looking for? Reverse, there we go. Reverse the overdose of an opioid overdose. It won't work on any other medications but opioids. So that'd be like your narcotics, be your oxycodone, fentanyl, that kind of stuff. So it's all the Narcan used in our county right now is nasal spray. It's not the injectable kind. So those boxes are there, and then we also have 2 vending machines. We have one outside here at the library, and then one's going to go over at the college for the college students. So in these Narcan vending machines, we have the Narcan, we have sharps containers, we have wound care kits, hygiene kits, condoms, tampons, pads. I think that's it. And then we're also purchasing a large sharps container dispenser to go at public health, and we'll manage that. So those are some of the initiatives. We purchased some education for 6th graders, I believe it was 6th or 7th graders, that will start in the fall with the help of the sheriff's department and the teachers. And then we will be looking for other ways. We're looking into Deterra medication deactivation packets. So they're like, they dissolve them, but they deactivate the drug so it will not harm the patient. They're pretty environmentally friendly, so they can throw them in the trash can, and it will take liquids, cream. It won't just deactivate opioids, it'll deactivate all medications. So we're working on a big initiative with funeral homes, pharmacies, and families, so across the county. So that'll be something that's neat to come. And like I said, we did do and still do a lot of training and events across the state. So there's that. We did go into the community health needs assessment. I didn't realize how far ahead I got on myself there. I really don't have much more to share on the community health needs assessment except for it's coming up. We'll be doing a new one, so look for that. Hopefully you guys will participate. There's quite a few questions in it, but all the questions selected are very pertinent to what we do and what we need to do to provide the best care that we can. Our health and resource fair. So we did a senior health and resource fair last year, but realized that I think it was a little, people didn't really show up as much as we were hoping. So the fair really isn't just for the 60, 65 plus. It's for, like, even, I guess I would maybe attend. I just recently lost my grandma, and I learned a lot through the process, even have worked in hospice and home health. When you lose somebody you love, you realize that there's so many other avenues and things that you have to look at. But anyways, this could be for anybody 40 plus. The fair, we have a ton of vendors. Last year we had over 40 vendors, which was great, and we're hoping we have that many this year. Last year we had it at the Grinnell Mutual facilities, but this year we're moving it to Hotel Grinnell to be more centralized, more local. It's walkable, right? It's right there, and we'll have some food and snacks and stuff like that. But who's going to be there, right? So we'll have the funeral homes there to give some education and information. We'll have the fitness department at Pastels. We'll have public health there. We'll have what's the sweet lady that does the color swatches and your like color palette, the consulting.
Jennifer McAlexander.
Yes. So she's there. We have the Arns Foundation there with all the different funding and resources. We have pharmacies there. We have so many things. Not Mom's Meals, but like the Meals on Wheels, and so you get the picture. It's a very large, right? We have a bunch of different partners at the hospital that'll be there. So nursing homes will be there. So it's if you're needing resources to know about your aging parents or about your spouse or yourself or how to get planned and set up for things like my grandpa, they had their plot purchased, but they didn't have their funeral paid for, and so that was very hard on him, and watching him go through that was very, very hard to see. Sorry. And then, to the fact of purchasing her casket, like that was very hard to watch that. So, you love somebody. I mean, it's even got me thinking about that, and I'm hopefully not there, but tomorrow's not promised, right? So just making sure that you got all your resources in check. Anyway, so it'll be a great event. When is it? May 23rd. Watch social media, watch the newspaper. It'll be from 9 to noon at Hotel Grinnell. If you have resources that you want to share that you think are great, send them our way. Call and let us know that you'd like to see this person or that person there. If we can get them, that'll be great. Yeah, it'll be great. Okay, so some final tips and takeaway. I'm almost through this, you guys. Start putting you to sleep. Public health. We, like I said, are over at the Light Center. We're open from 8:30 to 4, Monday through Friday. We're closed on the big holidays. If you want more education, we highly encourage you to join our Facebook group if you're Facebookies. We post lots of education on there. We did use our community health needs assessment to kind of gauge the education that we're putting on our Facebook. We share lots of resources and community events as well. If you'd like to attend our Healthy Choices Coalition, we'd love for you to join us. We meet the fourth Monday of every month from 12 to 1 at the Public Service Building at the Grinnell Fire Department or online. Excuse me. And then also, if you're at the farmer's market or one of the public events that you see public health tablecloth there, come over and say hi to us. We love to give away freebies that the hospital purchased for you. No, I'm just kidding. We bought our own too. If you have any ideas ever, you think that we could do something in a better way, if you'd like to see an initiative or a program or a class or somebody brought in, please send us an email, give us a call, let us know. We're here to work for you to help you live your best life. And so if there's any way we can help you guys, please don't hesitate to reach out. We'd love to hear from you. And then there's my information. That's it. Anybody have any questions?
Awesome. Yeah. Any questions?
That was a lot of content.
I have one to start. So you talked about, I have actually two. One, where's the location of the AED in Grinnell again?
Yeah, so, I'll scream at you. You don't need those subtitles. There's two at Arns Park, and I cannot remember the exact locations. There's one on a flagpole up kind of by where like the walking path starts, and then there's one on the south side of the concession stand. I think it's like the boys ball diamond maybe down there. And then there's going to be one at Central Park here in Grinnell. They were working on like the logistics. It has to be hardwired, so for the climate control box, so they were working on that. And then we just delivered the county conservation theirs. And I think it might be going on one of their bigger pavilions where they do a lot of their activities, kind of down by where the entry to the water is. The neat thing about these devices, or like the yellow climate control box, they were created by, I believe, don't quote me, but I think it was like military task force. So because that was a concern, vandalism and breaking in and stealing. The AEDs are very expensive. These boxes are pretty much vandalism proof. Yeah.
Very cool. My next question.
Resistance, there you go.
Resistance, yes. My next question then is, you talked about care after a mother delivers or a woman delivers their child. Do you have any care beforehand? I'm thinking, I'm going to put on my hospital board hat now. Yeah. I'm thinking about like how many individuals we see who have never gone to a doctor during their pregnancy at all. You probably know recently there was one Sunday where there were 3 C-sections, and not one of those C-sections had ever seen a physician that entire pregnancy. So I'm wondering about, you're doing such a great job of meeting people where they're at. Are there plans for outreach, even just awareness of where they could go see a physician? Maybe it's not in Grinnell, maybe it's somewhere else, just somewhere to see a physician during the pregnancy?
Yeah, very great question. Yeah. So one thing that we get hit hard with is cultural, you know, aspects of things. We do outreach. Our providers, our OB providers, go up to Marshalltown once a week right now, I believe. I think it's once a week, every week. And then Steph goes up there too to kind of help be, hey, this is what to expect afterwards. But I do share a lot of information with my partners, my public health partners, other directors, and stuff like that. And honestly, that has been my biggest roadblock, is getting communication to people. And like, you know, we lost the radio, the newspaper is an arm, a leg, and a liver to put in sometimes, especially if you're adding content all the time. You know, there's a lot of stuff to share, so that is very expensive. I think it's gotten better in the last year. Our providers are really, and our marketing team is really trying to amp up promoting what care we have, when to seek care, how to seek care. I can't speak for the hospital on initiatives about like what plans are to come as far as increasing outreach and stuff like that. I know it has been talked about, but when we've got to establish us first before we can give to other people. But we do try to educate and let people know. We have talked with, you know, marketing with the Newton Hospital and letting them know where to go. Yeah, it's hard. It's scary when, you know, the mom comes in. We don't even know how old the baby is at that time and what team to put on place and things to get in gear. So yeah. But I'm glad to know that other people are recognizing that. And so if you guys have good ways, you know, other ideas to get information out there, let us know. Yeah.
Given that the federal government's focus on certain things is decreasing, what are you worried about in terms of support you get from the federal government?
That's a good question. I try to plan for the best and try to do things as much as I can with local help. That way, if things do affect us from the bigwigs, the federal government, maybe we can keep floating. It's all uncertain what public health will look like in a year or 2 years. I mean, I think, and I hope, you know, that our governor will listen to us and know that we need a local presence, because it is very, I mean, I didn't realize how big public health was until I stepped into this role. Even 6 months in, I was like, oh my gosh, you know, but I started learning all the things and finding my footpath and knowing listening to people and trying to figure out a solution. Can I find it all? No, but I can try. So I don't know. I can't really answer that. Pray for the best and go from there, I guess.
Thank you. This is very nice today.
Thank you.
I think the health fair will be wonderful.
Yes,
And
I hope you guys all come.
Thinking if it was on the day of farmers market, it would be you'd really get people through there. There is so much. I'm just, you know, my head is full of everything, but that's why I think a fair would be really, really good. The question I wanted to ask you about COVID shots. Where are we with COVID shots now? You used to be doing them at one time. You came to Mayflower to do them. Then not. Where are you? Do you know where we stand with COVID shots now?
At this point, we haven't heard of any other boosters. We kind of just wait and see when we actually, a lot of times the community finds out things before we do, and then we get calls, and then we're like, oh no, and then we find out like a few days later. But it kind of just depends on especially with like the Mayflower or St. Francis, on what the leadership is wanting at that time. And when we get our stock in, a lot of times like Hy-Vee will get their stock way before we get ours. Like, oh my goodness, what just came out? The Prevnar 20 just came out. The pneumonia vaccine, just that whole new thing came out. The pharmacies will get theirs before us, and then people will go to the pharmacy. And if they can get all three at the pharmacy at one time, I wouldn't do it. But if somebody wants to do it, that's on them, and they can handle it. You go get all three at one time, and then you don't have to go back, right? So, I mean, a lot of people will do that, which has been a deciding factor on how much we order, because then public health can only return so much, and then we have to swallow that funding. So we love to do that. We love to go to the Mayflower. We love to get out there and see all of our friends in the community. But if they get somebody in before us, yeah, we don't fight it. We just want everybody to be healthy.
Along with that, I guess the question is there a new variant? And if there is there a vaccine that's responding to that?
I'm not aware of a new variant at this time. I try to stay up to date. We get reports from the state every week, like a weekly report on new trending things. So I did not see a new variant at this time that I'm aware of. And a lot of times vaccines are built off a previous, that's how they build up they make that vaccine. So even if there was a new variant right now, they wouldn't be building it off of that variant specific, because it'll be gone by the time they distribute all that.
Given the pressure on local and regional hospitals, and in particular the elimination of obstetric services at many hospitals, how do you see that affecting your role?
I don't think it'll affect my role too much. I think it's unfortunate for those hospitals, but wonderful for ours that we could grow that department. I know they're doing a lot of work expanding the OB department rooms and facilities for the increase in patients. I think it'll be great for my nurse Steph to increase her services. In an ideal world, I'd love to have 2 full-time working postpartum nurses, but it's not a required benefit of having a baby. It's elective. So a lot of moms do say no, not knowing what they're going into or what would they get out of it. So it's an opportunity for us to do a lot of education in the community, and we're trying to go to those new mom classes excuse me, and educate moms. And like most of you guys know, going from 1 baby to, I have 4 kids, so going from 1 to 4, no pregnancy was the same, no breastfeeding experience was the same. So it is nice to educate on that as well. It's just because you have 1 child doesn't mean you're an expert. And if any of you are an expert in teen children, let me know. I have a 15 and a 13-year-old, and I need all the help I can get. I'll put a little tip fund up here if you want to support my vehicle. No, I'm just kidding. Any other questions?
All right. Well, thank you, Brooke.
Thank you
so
guys
very
so
much
much
for being here. Thank you.
Appreciate it.
Thank you. Thank you. So thanks, everyone, for being here today. Next week, we have a presentation from, I don't know the exact number, but some Grinnell College students about celebration of International Women's Day celebration around the world. So students, international students will be presenting about how they celebrate this day in their homes. And it'll be really great to meet Grinnell College students and then learn more about the celebration from around the world. So thank you, everyone, for coming today. Have a wonderful rest of this blustery day. And take care. We'll see you next week.